Okay, so today we want to talk about hemoglobin A1c and glucose monitoring. So the hemoglobin A1c is a measurement of the amount of red cells in your blood that have glucose on them. So hemoglobin is a molecule that is circulating in the bloodstream and gives us this measurement that we have come to become our gold standard for diabetes control, called the hemoglobin A1c. And the hemoglobin A1c is measured every 3 months because that's essentially the lifespan of a hemoglobin molecule. And in that time frame, one gets an average of one's blood sugar. The reason why it's so important in diabetes management is because all of the clinical research studies that have looked at control and the complications of diabetes are related to the measurement of hemoglobin A1c. So when we were all of these studies looking at type 2 diabetes, type 1 diabetes, different types of medications, different types of treatment, whether you, if you were on type 1 diabetes, whether you were on a pump or not, all these clinical research studies use the hemoglobin A1c as the measurement of whether or not control was achieved. And so one then could look at the measurement of whether a patient was controlled with a hemoglobin A1c as compared to uncontrolled, and whether or not the complications were worse in one or the other. And all of these studies showed that hemoglobin A1c's at a certain level gave us the protection, so to speak, or gave us a lessening of the likelihood of a complication of diabetes. So that's what really the hemoglobin A1c is about, is it's trying to look at whether or not one's going to develop the complications of diabetes.